past year, just 2% of customers had only one option. Next year, it could jump to as much as 17%. 9 states will potentially have areas that only offer one carrier with plans through the Affordable Care Act. And joining us now is the Director of Healthcare Policy Studies at the Cato Institute. Michael Cannon is here. Michael, how does this affect Obamacare moving forward?
Well, the main problem is how Obamacare is affecting the sick. You know, everyone seems concerned about whether Obamacare is viable, but what's happening here is Obamacare is literally punishing the insurance companies that provide coverage that's attractive to the sick. That's why these companies are being driven out of the marketplace. The ones that remain are the ones that provide coverage that is unattractive to the sick. And so even in Pinal County, Arizona, there are going to be no Obamacare insurers, which really belies the president's promise that you can't be discriminated against if you have a pre-existing condition under Obamacare. But even if the exchanges are viable, Obamacare still discriminates against people with pre-existing conditions by making their coverage progressively worse over time.
All right, and I've got David Webb on set, somebody who follows this extremely closely. Where's this all going, David?
Well, it goes to what he just said. And when you talk about the net effect of Obamacare, if it's gone from the county, it's not delivering what it claims. Once again, the president has effectively told the American people something that didn't come true. Read that any way you want. But the defined idea here by the left and by the Obama progressivism was to crush the marketplace and then force a single payer in place. It's economically unsustainable. You can't maintain it. The taxpayer can't. We can't have more people taken out of the system using government-run health care than paying into it and have it survive. It's much like Social Security or any other entitlement. It will eventually fail under its weight.
Well, it's exactly like Medicare, Michael. I mean, and that's going broke in 12 years, and we haven't fixed that.
And the president's solution here is to throw more good money after bad. You know, he promised that never again would we see premium increases like the 39% increase in California that happened around 2010. But we're seeing that sort of thing under Obamacare all the time. And his solution is create a public option, a government-run plan that they can just subsidize the heck out of so that they can just pay those ever-rising costs under Obamacare by pushing the costs off onto taxpayers. What we're not getting is innovation that drives down the cost of care, that brings care within the reach of people who couldn't afford it yesterday. What we're not getting is innovation that makes health care more secure for the people who need it most. We were getting that innovation before Obamacare. Obamacare destroyed it.
Look, let's assume that, it's Michael Block, Michael. Let's assume that Obamacare is here to stay into the next administration. Let's make that assumption.
I would never assume such a thing.
I'm making that assumption because here's my question. Assuming it stays in place, what can the government do, what can the regulators do to help incentivize the private carriers to come back and provide more choice? Is there a middle ground here?
There's really nothing that can be done to make health insurance more secure for the sick as long as Obamacare is still on the books. Now, that doesn't mean that there's going to be the political will in Congress or in the White House to do what needs to be done, but in the meantime, patients are going to suffer as a result of this.
But, Michael, one idea from the insurance companies is you increase the penalty for the healthy to buy the insurance. That's the central problem, is they're not getting enough young and healthy people under these insurance contracts, that they're being forced to insure people who are extremely sick and costly to insure. That's not an option. That's not something that they're going to do, is actually maybe enforce the law and make people buy this insurance.
Well, the insurance company lobbyist solution is always give more money to insurance companies. And that's what the idea of increasing the individual mandate penalties would do. Either you pay more money to the insurance companies or you pay more money to the government so the government can give more money to the insurance companies. That's just throwing good money after bad. Well, we should make the insurance companies compete for the money that they get from consumers, not go to Washington to get more of it.
Michael, it's David again. See, what we're talking about here is predictable failure as I see it. Everything we're talking about, everything that Dagan just brought up, is basically shifting the dollars around into failure. But the Obamacare plan could never account for the market decisions made by insurance companies, made by the healthcare delivery system. So therefore, it was never going to be designed to work effectively. And you said it, it's to push people towards this single payer. It's predictable failure. We saw it with the National Institute of Health in Great Britain. We've seen it it in Sweden and other countries where they've privatized to get away from it, and yet somehow they think we're going to make it work here. It's economically unsustainable over time.
I think that's correct. And the people, we need to keep our eye on the ball here. The people who are suffering under Obamacare are the people who develop pre-existing conditions, who could have had secure access to health care through the guaranteed renewable plans that were available on the market before Obamacare, through new innovations that were being developed as Congress was debating and passing Obamacare, but that Obamacare completely destroyed. And the only way we're going to make health care more affordable and more secure is if we change who controls the $3 trillion that this country spends on health care. We need to give that money to consumers.
Michael, let me
it.
take this finally to the election at hand. And we have heard Donald Trump more than willing to share his opinion on all of this. And he says he's going to repeal it, replace it, and get something great. What do you make of the conversation on the campaign trail right now about what to do?
Well, you know, Donald Trump says he wants to repeal Obamacare, and I think that's the right approach, but both he and Hillary Clinton have a credibility problem. That was reflected in a recent poll that found that majorities of the public believe that neither Donald Trump nor Hillary Clinton are going to make health care better. I think that is a huge vote of no confidence in both candidates on health care.
And nobody wants to fix Medicare, which is the central problem. They can't even fix Medicare and make that sound before that they created this Obamacare. And neither Hillary Clinton nor Donald Trump talk about tackling entitlements, period.
Nothing.
All right, Michael Cannon, thank you for joining us this morning. Good to have you.
Thanks for having me.
All right.